This conference will now be recorded.
Smile evening.
Okay.
Hi, ma'am. Can you hear me now?
Yes, your voice is good now. So
Okay.
thank you so much for giving your time. And now we will start our session. Really, really very, very thankful to all of you. And thanks to our team, our sharing is caring team. Yes. And there are so many participants. They have a good, great intention to share their experiences and knowledge. So today we have Gitanjali here. She will discuss about pituitary gland, and one of my senior student, and I'm very happy. And she has, good practical knowledge. She has all, clinical experiences. That is why, when you hear some experience who is already practicing clinically, then, you will really get pearls of wisdom. So you will get opportunity to hear many participants one by one, and you will get good knowledge. So before we start and before we hand over to Gitanjali, I will hand over to Suman. Suman, you
Yes,
can
ma'am.
lead this session.
Thank you all once again for joining in today. As part of our sharing and caring activity, a group of volunteers, sit together, compile notes, and understand exactly what is any additional information that can be shared amongst all the students. And time to time, we go through all the questions raised and the doubts that all the students come up with. And based on that, the senior most students compile their knowledge, and we come up with sessions that is beneficial for all. So as part of today's session, we're going to be focusing on a very, very important gland. This is also called the master gland, but surprisingly it's a very tiny pea-sized gland that controls all the vital organs and the vital body functions in our body. They regulate all the hormones and everything else. And this is nothing else but our pituitary gland. So Gitanjali ji is going to take us through the importance of the pituitary gland and also how we can ensure that it functions, the way it is functioning or way it is supposed to function. And also she's going to guide us on how to keep it in its optimal health. Okay, so over to you, Gitanjali ji. Please continue the session, and I'm sure all of us are going to enjoy your session as well.
I hope I'm audible.
Yes, you are.
Okay.
But we are not able to see you.
Where is Gitanjali's video?
Yes,
Gitanjali?
we're not able to see her. Yes.
Yeah, just
Yes. Yes. Yes, now.
Thank you.
Yes. Okay.
Smile evening, everyone. And ma'am, thank you so much for saying all these kind words. It's all your guidance all throughout my Sujok journey. So thank you for giving me this opportunity. I mean, I wouldn't be here unless you had pushed me and taken me here. Thank you. So
You are wonderful. I don't have words. Yes, please.
thank you so much. Now to start with our, before we start the
Please
pituitary gland.
mute everyone. I request before Gitanjali starts, you will really enjoy this lecture. Please mute your mic. Yes, so that we have clarity of voice. So check your mic, please. Okay, Gitanjali.
Before we start with pituitary gland, I thought everybody should be aware why this endocrine gland system is very important to us. So before we start with the pituitary, let me just give you a quick overview as to why these glands are so very important to us. What is an endocrine system? It is a system of ductless glands, and it releases hormones. Hormones circulate in the body. They are just messenger molecules, and they trigger the reaction that our body gives to any action or any situation. Basic category of hormones are amino acid based and steroid based. Now, endocrine organs are can be categorized into two main categories: the organs which do only endocrine function and organs which do endocrine function, but they also have exocrine function in other systems. Like purely endocrine organs are pituitary gland, thyroid gland, parathyroid glands, adrenal cortex. There are two glands, that is cortex and medulla. And endocrine cells in other organs are pancreas, thymus, gonads, and hypothalamus. Now, why are these endocrine glands important? Or if you see the functions which are regulated by this endocrine system, you'll see they regulate our growth, they regulate our healing, water balance, blood pressure, calcium metabolism, energy metabolism, stress, regulation of other endocrine organs. Now, if you see the scope of this entire system, you will find that they are regulating or they are influencing almost everything that our body is. So they are very, very important. Now, how do we know that there is a endocrine disorder? There are some common signs and symptoms. There are change in energy levels, fatigue, change in the patient's tolerance of heat and cold, recent change in the body weight, unexplained change in the body weight, sudden body weight or uh, gain or loss, change in the fat distribution. Suddenly, you will find change in the fat distribution, change in the physical appearance, appearance of the facial hair in women, moon face, buffalo hump, thinning of skin, obesity of the trunk only, and thinness of extremities, that is your hands and legs. Increase in the size of feet and hands, edema, and elevated or decreased blood pressure. Now, if you see signs and symptoms, you all
Ma'am,
please
what is the
note
meaning
down.
of moon phase?
Sorry, can you please?
Ma'am, what is the meaning of moon phase?
Huh? You were asking something?
Ma'am, what is the meaning of moon phase?
I will come to that. I will come to that. Moon phase, I'll explain it to you in detail. Uh, with the pictures, moon phase, buffalo hump, I'll show you all. Okay.
Okay.
So if you see the signs and symptoms of this endocrine disorders, other than moon phase, buffalo hump, or some specific changes, most of them might seem like they can happen in other disorders also. So that is why it is very important that you get yourself tested, and only when the test says you have endocrine disorder, start working on your endocrine system. Okay. Now let's go to pituitary gland. Now, why pituitary gland is this thing important, or anatomy of pituitary gland? It is small, it's a pea-sized gland, and it is oval in shape. It is located behind the nose bridge. Behind the nose bridge, near the underside of the brain, and attached to hypothalamus. And hypothalamus is important because it controls the secretion of hormones by pituitary. It can also gland is generally divided into two lobes. It has anterior lobe and posterior lobe. Exercise is a strong stimulant to release all anterior pituitary gland hormones. So everybody, please exercise, even during COVID. And it is called master gland because it controls a lot of other hormones secretion. We'll come to that later in this.
Ma'am, your voice is totally breaking.
Your voice is breaking. Can you refresh your thing?
What do I do?
This
In
conference will now be recorded.
physical development, and it is primarily targets bones and muscles. Then we have TSH, that is thyroid stimulating hormone. Thyroid produces T3 and T4. And if thyroid is producing less T3 and T4, there is more TSH released by pituitary and vice versa. Then we have adrenocorticotropic hormone or ACTH. This stimulates the adrenal glands to produce cortisol and other hormones. We have FSH or follicle stimulating hormone. It is involved in reproductive system of men and women. It helps in secretion of estrogen, growth of eggs in women and sperm cells in men. Luteinizing hormone or LH, it is involved in the production of estrogen and testosterone in men. Prolactin helps in producing milk. Endorphins are pain relieving hormones. So are enkephalins. They also work with endorphins. And we have melanocyte stimulation hormone, which increase
A loss of disturbance.
in response to exposure to ultraviolet radiation. Now, if you see the work of all these hormones, you will see if you have any problem in the, why we always say if you have any problem in the reproductive system, you should also treat your pituitary gland. And if you have problem in your skin tone getting this thing, you should all treat pituitary gland. Now, posterior pituitary hormones, they are secreted actually by hypothalamus, and they are stored in the posterior lobe till they are released. They are vasopressin and oxytocin. It is antidiuretic hormone, and this hormone oxytocin helps in release of breast milk and also contraction of uterus during labor. Now, why do we have disorders of pituitary gland? Either there is hypersecretion of the hormones or hyposecretion of the hormone. There could be injury to pituitary due to accidents or due to surgery. And more common is pituitary tumors. Now, disorders of pituitary. Several conditions affect these pituitary glands, but main is pituitary tumors. Now, these are non-cancerous tumors. They are generally not cancerous tumors, but they interfere with the release of hormone. When they grow, they press against other areas of brain and leading to vision problems, headaches, and other problems. So, hyperprolactemia. In this condition, blood contains unusually high amount of prolactin, and this can lead to infertility and decreased sex drive. Traumatic brain injury. This involves sudden blow to the brain depending on the injury, and it can sometimes damage pituitary gland and cause problems in memory, communication, and behavior. Now, next we will go in the specific disorders of pituitary. We have anterior pituitary. They have some hyper conditions, hypocondition. Posterior pituitary lobe, again hyper conditions and hypoconditions. Now we'll go one by one into all of these conditions. Now, gigantism. Excess secretion of the hormone, Suddenly you will see a person with gigantism is very tall, say 7 to 8 feet tall, and huge growth, but they are hyperglycemic and they develop pituitary diabetes later. Acromegaly. Now, if you see, gigantism happens during childhood. There is excess secretion of growth hormone. Acromegaly happens when there is excess secretion of growth hormone in the adults. Acromegaly patients' bones increase in size, including their hands, face, feet, and it affects generally middle-aged adults. Now, what happens? They have with gorilla face, rough features, thickening of lips, thickening of skin, wrinkles, formation, this enlargement of hands and feet, visceral organs such as lungs, thymus, heart, liver, etc., and hyperactivity of thyroid, parathyroid, and adrenal glands. Now, someone had asked what is moon-faced and buffalo hump. Now, second one we will see is Cushing's disease. It's a rare disease. It is characterized by obesity, but if you see here, they have red cheeks, face. There's generally swelling on the face. They have high BP. They have like wrinkled skin, thin skin. Extremities are very thin. The trunk is like, only the trunk has a lot of obesity. So when there is a pituitary gland involved, we call it Cushing's disease. If adrenal gland is involved, then we call it Cushing's syndrome. Dwarfism. This is exactly opposite to gigantism. Now, in dwarfism, there is stunted growth because growth hormone secretion is very less, and body parts are proportional. There is no mental retardation, and reproductive function is normal. Acromicria is a rare disease, and there is atrophy of extremities. You see this atrophy. You will be able to see the nails are deformed, the hands are deformed. There is a lot of this hair growth over here, and this is because of deficiency of growth hormone. Siemens disease. Siemens disease is a chronic deficiency function of pituitary gland, and it is because of less hypopituitarization. There is always atrophy. If you see everything is getting wasted. This person, if you see the bones and the muscles and everything is wasted. So it affects other organs also like heart, liver, spleen, kidneys, thyroid, adrenals, and gonads. And it causes emaciation and death if not treated. SIADH, syndrome of inappropriate hypersecretion of ADH, that is antidiuretic hormone. So there is characterized by loss of sodium due to hypersecretion of ADH. Now it happens because of cerebral tumors, lung cancers, and other these signs and symptoms are loss of appetite, weight loss, nausea, vomiting, headache, fatigue, and restlessness. And patients can die because of lymphoma and convulsions. Diabetes insipidus. Now, this diabetes is different from diabetes mellitus. Diabetes mellitus is what we generally call type 1, type 2, type 1.5 diabetes, but this is not that diabetes. Now, here again, this is a salt and water metabolism disorder where large volume of dilute urine, which is fast, and because of hyposecretion of ADH, that is antidiuretic hormone. And there are two types: central diabetes insipidus and nephrogenic diabetes insipidus. Now, this is central diabetes insipidus. What has happened? This pituitary gland doesn't make enough ADH, so kidneys don't get any direction from pituitary, and they keep producing lot of urine. And these patients have major dehydration issues because they are continuously producing urine and passing it out. In nephrogenic diabetes insipidus, there are ADH is produced by the pituitary, but your nephrons cannot take them. So there is disconnect over here, and that is why this diabetes occurs. Now, symptoms of pituitary gland disorders are it is involved in so many functions. So any condition involving produces various conditions, and it is very important that you should go to the doctor and you should get yourself checked up before you decide yourself this is because of pituitary gland disorder. So when should you make an appointment with the doctor? If you have continuous headaches.
प्लीज एक चीज बता दीजिए.
Sorry. If you have continuous headaches, weakness or fatigue, high BP, unexplained weight gain, trouble in sleeping, changes in psychological state, mood swings, depression, memory loss, reproductive issues, infertility, erectile dysfunction, irregular periods, excessive or unusual hair growth on the face, especially for women. Lactating when you're not nursing. Lactating when you're nursing is normal, but lactating when you're not nursing is abnormal. Most of the conditions that cause these symptoms are easy to measure and can manage and underline cause.
प्लीज एक चीज बता दीजिए, मैं कुछ बुला रही हूँ आपको, हूँ करा रहे हैं उससे. जरा मेरे फोन पे म्यूट गो टू मीटिंग से मैं गीतांजलि का कुछ एक सेशन अटेंड करना चाहती हूँ, लेकिन वो म्यूट से ऑन ही नहीं हो पा रहा है.
Sujata, we can hear you.
Sujata.
उसकी आवाज नहीं सुनाई दे रही है. आप वो लगा लीजिए.
Sujata. Sujata.
Okay.
अंजलि थोड़ा सा आपका वॉइस ना बीच में क्रैक हो रहा है, एंड एक्चुअली सबका वॉइस सबका वॉइस अच्छे से आ रहा है. आपका वाईफाई नेटवर्क ठीक है?
मैम थोड़ा सा प्रॉब्लम है मेरी तरफ, मतलब
नेटवर्क का इशू है
थोड़ा सा है.
यस, आप क्या करिए,
वॉल्यूम
यस थोड़ा सा लाउड बोलना और slowly बोलना, because your words are sentence is cracking, so some words are missing when you are speaking. Sujata, please mute your mic.
वीडियो ऑफ क्यों है?
ओके गीतांजलि, थोड़ा सा जोर से बोलना एंड स्लो बोलना, so that वो cracking मिस.
काइंडली गीतांजलि मैडम, लैपटॉप थोड़ा नजदीक रखें अपने पास, थोड़ा दूर है वो.
Okay. So, what are the tips to maintain good pituitary balance? We have to eat a balanced and healthy diet. Balanced diet is good for our health. It can also affect our hormone secretion. Is it okay, ma'am, now?
Yes,
Hello?
yes. Slowly,
Yeah.
slowly. Yes, yes. Okay. And mic के आगे थोड़ा.
Yeah. For example, malnourished children may not produce enough growth hormone, which we all can know that, and that is why we have to eat good healthy food. Now, what is good healthy food? Food that is rich in fruits, vegetables, and vitamins and minerals. Good source of fat such as omega-3 fatty acids or monosaturated fats. Opting for whole grains rather than refined grains. Reducing sodium intake. Avoiding refined taken from American Dietetic Association page, and here, since they drink less water, Indian conditions will need more water, maybe. So, and what else we should do? We should reduce our stress. Chronic stress leads to increased cortisol release and cause insomnia, weight gain, anxiety, depression. So we should set aside at least 30 minutes of per day for exercise, and we have to work on relaxing hobby. Meditation is great if you can all do it. Now let's go to the Sujok part of treatment. So this is the pituitary gland location in your hand. On the finger, where you will have pituitary gland, there are pituitary nails, that is your left hand ring finger and left corresponding toe are your pituitary nails. We also have Ajna Chakra, which is co-located with the brain and pituitary gland. Now, pituitary is roughly bindi point as per Sujok treatment of the head area between eyebrows. Treatment to stimulate and massage pituitary point. Use red color to tonify, brown color sedate, and we have to apply after stimulating, massaging, we have to apply seeds, that is star any seeds that you receive or star magnets. Pituitary nail, left hand ring finger and left foot ring toe. Press the pituitary nail 4 times in the center, on the side, all sides, and then you can apply seeds or magnets over here, or you can put one big seed on the nail also, or you can do it on the sides also. Of course, 5-point treatment which we have to do. We have to stimulate and treat Ajna or hotness chakra. Always treat brain, heart, liver, kidney for any disorder of pituitary and otherwise also, because these are the main organs which should be always taken care of. In pituitary, although it's not in over here, but you can take your brain meridian and this spinal cord meridian, and you can also treat the end points, brain and meridian and spinal cord meridian end points also, or you can take painful points on the meridians and treat over. Thank you. I'm done. Any questions?
Ma'am, can you show the nail part of it, ma'am? Can you explain the nail?
I will. Left hand, right, and ring finger nail is your nail which corresponds to your pituitary gland. Same left foot and same toe.
चीजें बताओ तब तो बताएं क्या ऐसे बताएं हम.
So it is a pituitary nail. What you have to do is press the nail in the center 4 times minimum, and on the side, both sides, and top and bottom, right? So you are stimulating this area like how you do it, because naturally nail hair, you can't do it with gymming. So you have to press it nicely and you have to stimulate all this area. After that, you can just put one seed over here, or you can put seeds on the side also. Those go side to side and top and bottom. That is what. Does that answer your question?
Yes, ma'am. Thank you.
Excuse me, ma'am.
Yeah.
Excuse me, ma'am. Ma'am, why do we use red and to tonify and not orange?
I think ma'am would be a better person to this thing, give answer to that.
Okay.
But
सुनो तो साथ में फिश
Okay.
रखी और शायद पर चावल भी
if
खाएंगे 2 पराठा
you
और फिश चावल
Sujata, we are hearing your
और
do
गाजर
paratha.
ये पूरा खोल के रखो, ये बंद क्यों कर दिया है?
Sujata,
ma'am, she cannot hear anything, so she thinks we also can't hear.
okay. So now regarding red color, you see, of course, yes, we, as per 6 key consciousness, we are applying orange color. But when we think about tri-origin consciousness, this, according to tri-origin, red is for hetero. Yes, if we want to tonify anything, we apply red color. And if we want to sedate anything, we are using blue color. So we have both consciousness. It depends what is the consciousness of the therapist while he is holding patient's hand.
Thank you, ma'am. Thank you, ma'am.
Ma'am, anyone else?
Excuse me, ma'am. So
Uh,
can you please help me understand how is the skin tone related to the pituitary gland?
sorry, I didn't get your question.
Like as you have mentioned earlier that the skin tone is the result of the pituitary gland. So can you help me understand more about it?
Yeah. Do you want me to go back to the hormone part, or you just want me to tell you?
No, you can just tell me like how it
Okay.
is related. Yeah.
Okay. There is a hormone which is secreted by pituitary, which gives our skin tones, basically. Of course, genetic part is also there, but that is what happens when we with the hormone. If the hormone secretion is more, naturally, your skin will become more darker, or it will become it will react to UV rays faster, and you will become when you go out in the sun, you will become dark and things like that. If you notice, people who are fair, they have less melanin in their in their body, and as a result, even if they go in the sun, they don't tan so easily. Vis-a-vis a little darker shade person, if I go in the sun, I tan very easy. So that's how it works. And it is secreted by the hormone, and hormone kind of controls how much tanning can happen. Does that answer your question?
Yes, ma'am. So what is the solution for that? Like if we treat the pituitary gland, everything like will fall into place?
Some extent. Uh, yeah, but level 1, you just have to this thing, take pituitary point. You have to treat your pituitary nail, and you can take other this thing. But of course, tanning is not only related to pituitary also. Yes, the hormone plays a big role, but your diet and all other things also play a big role.
Yes. And that is why this pituitary gland is so important when we are studying, because now this is regarding level 1. So when you are doing 5-step treatment, in the end of your treatment, we are putting 1 point on pituitary gland. And I wanted you to know this importance of pituitary gland, because we are just generally doing our treatment. Yes, if person has knee pain or some liver problem or some stomach problem or backache, it is all related internally. If you go, then you will find that there is some relation with the endocrine gland, and pituitary gland is master of all glands. So it is very important that in your 5-step treatment, at the end of your treatment, you do pituitary gland. And also, even if you are not doing 5-step treatment, whether you are doing just simple knee pain, okay, if you are doing just 1 step, yes, as I told you, sometimes patient is healed with just 1 step. So with 1 step, just add pituitary gland additionally. And when you are doing pituitary gland, just don't fix the seed randomly. You should deeply massage this point and then put seed. And if you can succeed in finding painful point, because we have on both hand, also you should check on the foot also. And if the point is very painful, this area is correct for treatment. So pituitary gland treatment is very important with the target and with correct point.
And ma'am always advises everybody for any disease, pituitary has to be taken. 1 point of brain and 1 point of pituitary has to be taken.
Thank you so much for answering my question.
Ma'am, can I ask a question? In children, for the growth hormone, if they have dwarfism in the childhood, if there are signs of dwarfism, like how do we treat for the growth hormone in the children, ma'am?
See, first of all, let me be very frank with you. Please don't decide as a mother that your child has dwarfism. You have to go to the doctor, or you have to get the child tested that he has dwarfism. Okay, but with level 1, again, we have to only do what I have told you so far, and that is pituitary points, pituitary nails, maybe a red color over here, and 5-point treatment, and for dwarfism also treat your liver, and because liver controls the muscles, and your this GB and other this thing, which will control your bones and joints. So that will also facilitate the child's growth.
So you to tonify wind also.
I'm not saying wind. I'm saying liver for muscles.
Muscle. Okay. Okay.
Ma'am,
can you explain that bit again, ma'am?
Energies. I'm talking about muscles and bones.
Okay.
Ma'am,
Thank
can
you.
you explain that bit again, ma'am, for growth of kids, like growth in to make them tall and something like that?
First of all, I said, if you are thinking for your own child, please go to the doctor. Let doctor tell you that he has dwarfism, or he is slow, his growth is not a normal. And only if the doctor tells, because all mothers, we want our children to be the best, tall, handsome, beautiful, all those things. So that is why I'm insisting on this part. And level 1, see, we are today looking at level 1. So from level 1 point, you have to only take this 2-3 points, maybe in main system, in sex system, in mini system also. Stimulate. If you want to tonify, use red color as per the consciousness of triorigin, or you can use orange color as per the consciousness of 6. That is up to you, your consciousness. I told you left hand this ring finger nail. You can stimulate that, put seed and 5-point treatment. And I also say, please treat liver, because liver controls muscles and also the joints and bones organ.
And
Does that
also
answer?
you can add one tri-origin tip, pituitary gland, because very easy. Index finger lower joint and little finger lower joint. Why this pituitary gland is here, you will understand in future, but this joint has connection with your this pituitary gland. So you should twist this joint very nicely. Do twist therapy of this joint of index finger and little finger, this homo lower joint. Yes, so this you can add when you're holding patient treatment or when you are doing 5-step treatment also. Just do stimulate this joint. Yes, don't forget this one. If it is and if you find some symptom which is very excessive, as Gitanjali has explained, if you find some excessive symptom, then you can put blue color around this joint, and if you find some deficiency, then you can put red color on these joint. So as a beginner, when we study triorigin, then we have to select actually out of 2 finger which joint is more important, but then as a beginner you can pay attention to both joints. This is very important joint for pituitary gland.
Yeah.
Ma'am, could you please repeat, ma'am? Please try origin point. Could you repeat?
Now Gitanjali can repeat. Yes.
Okay. As what ma'am has said, as per tri-origin consciousness, even if you have not done tri-origin, it doesn't matter. This index finger lower joint and small finger lower joint, these are pituitary gland joints. What you have to do is you have to twist this nicely, very well, both these joints, fingers. Then you can do massage over here.
And also when you twist for 1 minute, you will see some relaxation in your mind also, brain also. Just try it now. Both finger
You
lower
can all
joint.
try that. You can try that right now as you are listening to us. And over here, if the growth hormone, I'm just taking this as an example. If the growth hormone is less, or if there is hypocondition of pituitary, where the secretion of hormones is less, you can put red color ring all around these joints. And if the growth is excess or any hyper condition or excess of hormones are there, then you can put blue color over here. Now this is as per the tri-origin consciousness. So you will use only red and blue color, not orange and brown color. Is that clear? I mean,
Yes, one more
Very
question.
clear.
Which is the hand we have to use for girl children and boys, ma'am? Is it like left hand and right hand for the children also?
Okay. For female, you can use right hand, and for male, you can use left hand.
Okay, ma'am. Thank you.
Okay. And then there are many students here they have done 6 key. We can have very quick this tip on 6 key also. Now you have understood this activity or works of pituitary gland. And if you need that there is requirement to work on pituitary gland, then how you can approach pituitary gland as per 6 key. As per 6 key. You know this? If you have done 6 key too,
Hotness, energy. Hotness, energy.
Yes, very
Hotness,
good.
energy.
Very good. So via circulatory system, no.
It is through the endocrine system. We have to go to the pituitary gland.
Perfect. So you have 2 ways. Either you can go via circulatory system or you can go via nervous system. And it is good if you attend both. Yes. So you see, when you're touching 6 key consciousness, definitely level of treatment increases. Then let us talk about circulatory system. In circulatory system, you will rent, this is heart meridian, and on heart meridian, you will rent hotness point. Yes, as a result, hotness meridian will open. Yes, and then pituitary is on the, you see, circulatory system. Circulatory system, hotness point is controlling all endocrine glands. Then on hotness meridian, pituitary point is on the hotness point again. You rent this hotness point, and again this meridian is opening as pituitary gland. Yes, am I right, Gitanjali? Yes. So here you can do tonification or sedation, because this is just quick 6-key tip for 6-key students. And also you can go via nervous system. In brain meridian, you can rent humidity point, and spleen meridian opens, and then spleen meridian is representing all 6 endocrine glands. Out of 6, pituitary gland is hotness. Then you rent a hotness point, you again come back to brain meridian, this is pituitary. So this 6-key students can quickly get this clue. They have already done this. This is just idea that you should focus pituitary gland, and if you have all 4 level knowledge, then you can focus your treatment here.
Ma'am, we can do color therapy of the 6-key point on the
yes. And if you have not done 6-key, and if you have just level 2, then brain meridian tonification is good.
Can we use magnet for the children, ma'am?
Brain meridian tonifications, if enlargement of pituitary gland, then you can sedate with the bar magnet for 2 hours, brain meridian, because brain meridian is representing pituitary gland.
Okay, for tonification also we can use?
For tonification, you can use, yes, bar magnet, and for sedation, this is
Yes.
level 2.
Yeah.
And according to level 1, Gitanjali has given lots of tips, nails, and also you have, triurgin joints, because here you are doing simple treatment. You're not doing any renting. Yes, and nails, correspondent point in main system, insect system, like this.
Mom,
Yes,
can I ask you one thing? I have one doubt. Can I ask you? Mom, can I ask you one question? In a level 1, when I am putting seed therapies, the part is so much of itching and sensation is there. Then what is this mean, signs and symptoms? Can I continue the treatment? How it is? Yeah, the patient is getting lot of itching in that point when I put the seeds.
Yes.
Are you doing the therapy in the same place again and again?
Yeah, because she's having the pain the same place only. Every night.
She might have pain in the same place, but in Sujok, you have one body, second body. In your feet also, you have 2 bodies. Every finger has one body. So please change the place of your treatment.
Ma'am?
Yes, madam. Thank you.
Ma'am, one question.
Because getting seeds and same place getting pressure all the time, the skin gets irritated, and that is the reason for the your irritation of skin. Could be one of the reasons.
Ma'am, one question I have, ma'am. Ma'am, sometimes when we try to find corresponding points,
ठीक है, जो भी पूछना होगा, और तुमको जो भैया बताते हैं 1 kg की 2 पेजी,
Lakshya.
Sorry.
Your voice,
ma'am.
We can.
Ma'am, when we try to find corresponding points and painful points, sometimes one point is painful, but sometimes the other point, when we do the other side, we cannot find painful, and the patient keeps telling that there is nothing on the other side. So how can we understand?
You mean to say that one point is painful, yes, and on the other side?
there is no pain at all. When you try to find corresponding points at different location, just to cross check whether it is correct or not, sometimes the other point is just not painful. Like the pain what comes in the first point is not the same as in the second or third point.
Yes, not necessary that you will get same pain on all points. You have to focus the point which is giving more pain. That is final point.
Okay, ma'am. Thank you, ma'am.
Ma'am, one more thing. Ma'am, sometimes in the insect system there is pain, but not in the mini system, and vice versa.
Yes.
It happens. So, is it okay?
Yes. It is okay, perfectly fine. Yes.
It is okay, because as it is like last time when ma'am had explained, mini system points are very, very small, and you have to go to the exact point, and there is a lot of consciousness involved while treating on mini system. So it is okay. You treat where it is the points of the system, that's fine.
Okay, ma'am. Okay, ma'am.
Can I ask a question, please?
Yes.
Yeah, just wanted to clarify, like as ma'am explained that it stimulates the pigmentation, like skin tone. It takes care of, kind of, partially. So if someone gets some injury and the healing, after healing also there is a mark on the skin. For some people it comes back to the natural color, or it kind of softens the scar mark. Some people still get dark for quite many years. So even for that we can treat on pituitary. Will that help?
See, this is structural problem. This is not internal. This is some damaging of skin, some because of some accident, some some wound. It will go on its own. This is not because of pituitary.
And even application of like magnets, leaves mark, and it stays for quite many days. So that is structural.
I agree, and because we have lot of experiences. So with some people, their skin is very sensitive, and that is why we are very flexible. We are understanding their skin, and accordingly we are choosing seeds or magnets. Some people, they really respond very well to magnets, star magnets, and some people, they like to do they accept seed therapy.
Okay.
Madam, one question, madam.
Can I
Hello.
just add to that previous question?
Madam, I have one question. Hello. Hello,
Yes,
madam.
please. Yes.
Madam, in my right hand, both point finger and ring finger, bone is very painful, madam.
Which
and
bone?
Left side, uh, the pointing finger, last bone, madam. From
this bone?
yes. On the square base. Hello.
Can you show? Yes. Can you show your finger, the area, exact area? Can you come on the screen and show?
I will show, madam. 1 second. 1 second, madam. I will on my. Hello.
Okay. Yes.
Madam, I can't see. Here, madam. In this particular point. Here,
see?
in this point, madam.
Okay.
1 second.
I will
Madam,
try.
actually, that bone starting for point of the finger, madam. Both ring finger and pointing finger.
Okay.
Ma'am, can I just say something over here?
Yes,
ma'am?
please.
Yeah.
Yes, please.
I just want to tell everybody, if you have pituitary problem, you will get painful point over here. But because you have a painful point over here, does not mean you have pituitary problem. I mean, ma'am, am I correct? Because just because if you have pain over here, don't think you have pituitary problem.
Yes.
This pain could be local pain. This pain could be injury to your hand. This pain could be now it is cold, like cold and winter season. So you might get hurt sometime and longer. But I just want to tell you, pituitary problem will give you pain, but this pain does not mean you have pituitary problem. Of course,
Yes.
I'm not saying ki your problem is not something different. I just want to make this point to all the new students that please don't think vice versa. That's all.
Madam,
That is why, that is
yesterday,
why,
madam,
that is why
madam,
some
yesterday,
people.
Hello.
Mhm.
madam,
Excuse me, ma'am. I want to say something.
Yes, please.
Yes,
Hello.
Varsha. Yes, Varsha.
We have people who want to share their success stories about treating patients.
Wow, wow.
So
Good.
people will get new vision when they listen to them. So I request Commander Pawar to introduce them.
Yes, yes. Commander Pawar.
Okay.
Yeah.
Yes.
Hello.
Can you hear me?
Yes, we
Yes.
can hear
Am I
you.
audible?
Can we mute ourselves,
Gitanjali
ma'am?
ji has explained.
Thank you.
Hello. I request
Yeah.
everyone to kindly mute. Yes. Smile evening, everybody. Gitanjali ji has taken us through the journey of the pituitary and very well explained. Such an important gland. It is touching the function of so many organs. It is touching function of so many organs, and we have been able to now get a lot of glimpse into that, and also the very nice questions asked by the various participants. You see, whilst we are all on this journey, we also have been having some of our co-healers who have been MAM students. They have been trying their own with whatever cases they are finding or people around in their households, and some of them have got wonderful results. And even with level 1, level 2, and like that, they have got very good results. And in fact, there was some very nice sharing which was done. A little bit was done by Snehal ji. She had obtained wonderful result in two of the cases. One was recently put by her in terms of early graying at a teenager kind of thing, teenage, early graying. And another one was of, the uncontrolled shaking of the hands. So when we were talking in the background, these are very interesting, and one of them might even be one of these cases also. Can you all hear me? Yeah, can you hear me? Hello? Yeah.
Yes, sir.
Hello. So I will now, I think it will be useful for all of us to hear, and this should also motivate all the other participants also, all the students of MAM. It will be very encouraging to listen into what Snehal ji is sharing with us. So I request Snehal to kindly take the mic, and also request General Chadha sir if he can give her access for sharing her screen.
Sharing.
Yeah.
Just yes, she already has sharing option.
Great.
Yes,
Great.
sir.
So
Now I'm
Snehal,
sharing the
so
screen. Is the screen visible?
Neha, do you have option of sharing screen? Yes.
Yes, ma'am. I'm actually sharing it. Is it visible, ma'am?
No.
it's not visible
Just
on my laptop also.
press that sharing part
So it's in a PPT that I have made.
Yes, it will come. Press screens. Screen, press screen.
Yes, ma'am.
Can you see screen?
Yes, now the photograph has come. Your PPT, you have not clicked on the PPT.
Yes,
Yeah,
yes.
I think now it is early graying of hair. Your PPT has come.
Yeah. Yeah.
You can
So,
make it a PPT view, full view. It is now in the side view.
Yes, Snehal, it is now on the edit mode. You can put it in presentation.
Yes.
Yeah.
Perfect.
Yeah, smile evening, everyone. My name is Nehal Botre, and I have been using Sujok as a means of treatment for the past 3 to 4 years. That was even before I took a formal course in Sujok. I actually went as a patient to one of the Sujok healers here, Shilpa Narayanan ma'am, and she inspired me through her explanations and the concept to try it on my daughter and family members, and the results I got were very encouraging, and that is why I took the course. From December last year I have started doing the course, and with ma'am I have done from level 2 to level 4, and with that, I have tried to increase my consciousness by applying it on neighbors and family members. One such case was when my neighbor, who is 16-year-old boy, had early graying of hair on the back of his head. And it was specifically at the on the yang side, and none of it on the top. So the patient history was he had a continuous dull pain in the back of the head. All the MRI and scan reports were normal. He had also had cold for 8 months of the year, but in summer the cold used not to be there. So it was like he was having coldness excessive. He was very short tempered also, and the main problem was early graying of hair. Slight constipation problem was also there, and there was giddiness when he was getting up suddenly, which was showing excessive of wind. So his short temperedness and giddiness was showing wind. So it was coldness, excessive constitution. And the treatment that I did was, for first I did it for the head pain, which was lying on the UB pathway. I used magnet for that, and in one sitting, the head pain which he had for 3 to 4 years, it vanished, and it has not yet come back. It's been 2 months since I've been treating him, and it has not yet come back. And for his early graying of hair, I use the yang hotness chakra, and I sedated dryness in it. I did this treatment on one hand, and on the other hand, I balanced his constitution. I continued this for 4 to 5 days, and to give it a break, I did Li Longueuil magnet on one hand, and on the second hand, I did yang dryness chakra sedation. Also, I did used level 1 knowledge of applying seeds, that is move below the nail on the first phalange, because that corresponds to the area of where he was having dry hair. And I applied pepper on the pituitary gland. And after 2 months of treatment, this was the result. The first picture is showing the image that was taken on the second or third day of the treatment, and the second image is after 2 months. So definitely the graying has reduced, and also the texture of his hair has improved. So there is a definite uh, dryness reduction that we can see.
Excellent, Nehal, really.
Yeah,
Excellent.
Thank you,
excellent.
ma'am.
And I have one doubt here. So so here so any in
Yeah, let
engage
her
explain
complete
that.
first her talk. Please let her complete her talk, and then we can ask.
Sure, sure.
Let her complete. She's trying her
Sure,
best
sure,
to tell you. She's sharing with you. Yes. Please continue,
sure.
Sneha.
Thank you, ma'am. The next disease that I want to share here is the Parkinson's disease. This experience was uh, very different for me. Ma'am has said that reports help us, but it is definitely true that we may not get the reports to use also. One such example was here when this patient who is 52 years old, he came to me. He had involuntary shaking of hands, legs, and the head. As I was asking him on his history further, he explained that he woke up between 1 to 3 a.m. And he had no other symptom at all. Now, since this time corresponded to the liver time, I checked for painful points on the liver, and the liver points were painful. So I did needling on the liver points. In whichever system it was painful at that time, mostly it was mini system. And on the second hand, I did unified wind sedation. So with this treatment, in half an hour, his hand had stopped shaking. And I actually felt, oh, I should have taken a video before that, so that I could compare results. But even when he came the next day, that shaking had reduced so much considerably that I couldn't show it to anybody else, even at home, that the difference was so much. So I continued this treatment on alternate days for like about 6 weeks. And he said he was going to bring reports of whatever he had been taking treatment, and he prolonged it to almost 6 weeks. After that, I got the report that it was Parkinson's disease. And since I'm new to this, even though the symptoms were looking like Parkinson's, I was scared to immediately start on the treatment. So I was waiting for the report. And so when the report came, what I did was I uh, I rented in the brain meridian. I rented coldness because in brain the coldness area is where the dopamine is produced. Dopamine is responsible for the controlling actions of the body, and it is caused because of dryness, or rather disintegration in that region. So I sedated in the brain meridian, I rented coldness, and in coldness I sedated dryness and tonified heat on the first day, which was very effective. So in compared to the 6 weeks treatment that I had done, this 1 day treatment proved to be very helpful, obviously because it was treating the exact disease and not just the symptom. And on the next day, I used the humidity age. His age is 52, and he said it started approximately like 3 to 4 years ago. So I took a like chance and saw if it was like 48, below 48 years of age, and it helped a lot. So I used the humidity age, and then I rented brain hotness in that, and then coldness was rented in the brain, and then I sedated dryness and tonified heat. On one hand I did functional, and on the other hand I did structural. So now only after 4 sittings of doing the actual Parkinson's treatment, the patient says that there is 70 to 80% improvement in his condition. So I would like to thank ma'am for so much of the inspiration and encouragement, because I was very ecstatic with these two results, and it has boosted my confidence a lot, and I hope I can help many more people with this. Thank you so much, ma'am.
Excellent, Snehal. This is your great spirit is also there, that intention of helping, and then your pure smiling soul is behind. Of course, yes, 6-key, Triorgen, all these are consciousness treatment, as I always say, and your consciousness has also helped. With protocol, if you are smiling, your treatment is working, especially when we work on higher level treatment. Excellent. Proud of
Thank you so much. Thank you so much, ma'am.
Please keep sharing your treatment results. Yes.
Yes.
And this will really motivate everyone. And now you can, this slides, all this data you can maintain, and it will help us, and we can give to all people if you permit.
Yes, ma'am. Ma'am, actually, I have made it very last minute, so I'm sorry if there are any mistakes. At 4
It's
o'clock, I was.
yes. This slide is not important. What I have, what I could see was your spirit and your eagerness to share. Yes, you were so eager to share. I could understand the amount of happiness you are having after doing this treatment, and it has boosted your confidence. And we
Yes,
are very, and your this sharing has boosted our confidence. Yes, thank you so much.
thank you, ma'am. Thank you so much, ma'am, for your support. Thank you, ma'am. Thank you.
Madam,
Yes, Commander
madam,
Power. Yes, please.
madam. After I went so many places for treatment, after joining in Sujok, now I am finding change in my body. Early I am very cold. After seeing your videos, you applied blue color that I applied yesterday night. So immediately my body is hot up, got heated up
Was it blue
naturally.
or red color?
I used blue. I seen in your video blue color, so I applied it. It is having a tremendous impact on that place, madam. I am so many places I went. I didn't got the result, but in Sujok level 1 itself, I found some change, madam. Drastic change.
Very good.
This is
Very
all.
good.
This is yes. This is only ultimate solution for any problem as a conscious level or physical level. This much I understood, madam. Thank you for
Very
giving
nice.
us such a great opportunity. Thank you, madam.
Thank you.
Thank you.
And we
Thank
all
you.
should not give up. We should not give up. We should always try.
Okay. Thank you, madam.
Commander Pawar, anyone else is here?
Yeah, so the Nehal shared very nicely two of the success stories, and of course impromptu Mr. Jami Surya Satya also has shared something. Yeah, so at the moment we can continue with question answers, ma'am,
Yes.
if
So
if time is
anyone,
permitting.
yes. So we will have question answer sessions. Any questions regarding level 1 you have? Tomorrow we will have 61 revision session, question answer session, not revision. 61 students, be ready. I will send Zoom ID. Okay. So please, anyone who has question, any query, because we will keep having all these sessions, question answer session. You are most welcome to ask any question.
Ma'am, I have one question. Ma'am, when we do this 5-step treatment, one of the point is to check the spine point.
Yes.
So is it like, we need to check all the spine points and see which one is painful, or is it related to the illness?
Or last line, please, again.
I'm saying, is it like, we need to check the all spine points, or which one is painful, or is it related to the illness we are treating?
Yes, of course. If you know this person has a heart issue or liver issue, then we should go to specific vertebra. But if you don't know what is the cause, which organ is involved sometimes, then you should try to find painful point, and mini system is the best choice. In the small system, you can cover full spine.
Okay, thank you, ma'am.
Yes, and please make a point that nervous system treatment, when you are doing level 1, is equally very strong. So nervous system treatment, you should pay attention after finishing your treatment, whether it is small skin disease also.
Thank you, ma'am.
Ma'am, I had a question.
Madam.
Yes.
Ma'am, after putting seeds for the days, after I remove the seed, the skin is very, red and has rashes. Is it normal?
After putting treatment, you mean to say after after fixing magnets?
No, ma'am, after putting seeds.
Yes, so then it means skin is very sensitive. Yes, skin is very sensitive. What you do initially, you just try to stimulate those points, energize those points, and slowly your skin will respond. Once some harmony takes place, then you can put seed. Initially, some people, they cannot tolerate this tape also. Yes, the gum of this tape, the seed. Yes, so very few, but maximum people, they respond very well. But in case if you feel that rashes come after application of seed, then what you can do is, when you go to higher level, then we are just doing color therapy. That is very good enough. But as per level 1, our main mission is to find painful point and then fix seed on that. So what you can do is, finding painful point, you can do it. See, you can find the painful point. Yes, find the painful point. Don't fix seed there. From time to time, you try to press that point. In vein system insect, first you should know where is the point, and then try to massage that point one by one, and several times a day. And then slowly you will see, because when you are pressing some point, it is creating, or it is producing curative waves, and as a result, your skin will, after 2, 3, 4 days, your skin will start responding.
Okay, ma'am. Thank you.
Ma'am, can I ask you one question?
And
Please
someone
ask
has only
When we
and
put, I have
someone
done the
gets
level
rashes
2.
only on the yang side application of seeds, but the yin side it's all right.
Yes. And yang
It
side?
happens. It's only yang side the rashes come. Application
Okay.
of seed or
Yes.
yin side
Yes.
is fine.
Yin side is fine. Yes. Then you just do massage on yang side.
Okay.
If some cervical problem, and try to work on mini system, try to work on small area, so that you are not touching this big part of skin.
Okay. Thank you.
Ma'am, when we are looking for a painful point for any disease, so is it possible that every day you'll get a different painful point for the same treatment you're doing?
Yes, in chronic cases, you can get multiple points. So you can pay attention. If you treated one day, for example, person has some brain or headache issue, so you found painful point here, and next day you are not finding painful point here, but maybe here. Yes, try to treat that point. Your clear mission is to treat painful point. So don't worry that yesterday, not necessary that yesterday this point was painful and today this is also painful, because this is cured. This is cured. And sometimes for one disease, you can get many painful points. So one by one, and you will see after this point, first day what you did treatment, some percentage, some relief will definitely come. Okay, but now it means this point has given you 60% relief. Maybe this point has done its work is finished. Okay, then don't if you're not getting painful point, then don't do it again, because the problem here is solved. So now check all other points and try to find painful point here, and that is how you will see next day percentage is increasing from 60 to 70 to 80. So sometimes multiple painful points appear on the skin. Yes, it depends now. Yes, it depends. One is master point. I want to tell you one thing. Actually one point, that is why we use by the name of master point. If you hit master point, then all other points which are scattered here and there are also dissolved. But if we miss that master point, then we are then we have to do multiple work, but we don't know where is master point. Yes, so maybe master point is hidden in the foot, but here also we are finding some painful point. It is like branches of master point. So when we are treating this, result is coming, but not to not full percentage. Yes, and then but it is good luck, that you treated the foot first. As first you found the master point and disease is gone, and all these multiple scattered points are also solved. This is the situation. That is why we should not give up. We should be ready, and we should be very intelligent that these all points are like, you know, enemies, and they're escaping, they're going hiding themselves so that you don't reach them. You should be very smart. I will win like this.
Thank you, ma'am.
Ma'am, can I ask you
Ma'am,
a
can I
question?
ask you?
Yes, everyone can ask one by one.
Okay, ma'am, my name is Sunita. Ma'am, my husband keeps getting these fatty deposits on his body. They dilute on their own, but we see every year, some part of the body he keeps getting. So, is it a solution to, cure them permanently? Though they are not harmful, but it looks weird, ma'am.
Yes. So start working on, you will understand when you go to next level, because there is some energy behind. So now at present, start working on liver and spleen.
Sorry, ma'am?
Start working on liver and spleen points.
Oh,
Main
okay, okay. So massaging or along, do I have to put the seed also?
See, when I say treat liver and spleen points, then what is the meaning of this?
Yes, ma'am. Understood, ma'am. Okay,
Okay.
first stimulating the point and then putting this
Now
seed.
you are mature. Yes, when
Yes,
you grow
ma'am.
senior, we are just talking in one sentence, treat this point. When I say
Yes,
treat this
ma'am.
point, then maybe you can do moxa, you can do massage, seeds, like this, multiple points, check main system, insect system.
Yes,
Okay.
ma'am.
Ma'am, a question. Ma'am, when we put the black pepper on the eye points, sometimes the eye is also very paining after applying the seeds. The black pepper leaves mark on the hand, and sometimes the eye is also paining. Actually, we treat for eye correspondence with black pepper, but this is the result.
So try green gram, this green
Okay.
seed.
Moong.
Yes. Try
Okay,
this.
Thank you, ma'am.
Okay. Okay. Do massage and put seed. Yes.
Okay, ma'am.
Ma'am.
Ma'am,
Good
in
evening,
the
ma'am.
mini system, ma'am, in the mini system, this elbow yang side, where it will come, ma'am?
Mini system on the yang side here.
Ma'am, that finger is coming, no, that nail is there, no, ma'am. So then.
Okay. Okay. I will try to share my screen. Just a moment. I have to check. Just a moment. You have to give me 1 minute. I will just attach
Okay,
my camera with this. So you can take on Varsha. You can solve answers. I will prepare my camera. Varsha? Varsha is here?
Yeah. Yes, ma'am.
Yes. So you continue your questions, and by the time I'm preparing my camera to answer this question of mini system.
Okay.
Varshaji, I have a question. It is a doubt. When we use magnets, how we know it is working or not working? Because when I am using
Hello.
on me.
Am I audible?
Hello. Yeah, you are audible. Are you hearing me? Hello. Hello, Varshaji. Are you hearing me?
Yeah.
Can you hear me, Varshaji?
Yes.
When we are using magnet, how can we find out what is working, how it is working, not working? Because when I use on me, I was experimenting. I was getting some kind of like a current passing, how it starts like that. But when I used for my sister, she did not feel any feelings. How can I make out it is working or not working? How
Okay.
do we?
First of all, are you using bar magnet?
Yes, madam. Bar magnet. Yes,
Just
bar
give me 1
magnet.
minute.
Yes.
No sound, no sound.
I think everyone has got muted.
Hello. Okay. Am I audible?
Yes.
Hello.
Yes, Varshaji. Now you're audible. Now you're audible,
Okay.
Varshaji.
I
Please
can't
go
hear
ahead.
your voice. Just a minute. इकडचं लाव ना. नाही इथं नाही येत.
Yes, Varsha, you are audible, please.
Okay, I am telling the answer. Whenever you put the bar magnet, if the person feels very sleepy, that means it is a positive. He is accepting the magnet energy.
Yes.
Second,
Okay.
if whenever you put the magnet and after 5 to 10 minutes, if a patient feels uncomfortable, something मुझे कुछ अजीब सा हो रहा है या I am not feeling or feeling giddy, some imbalance is there, that's what he is feeling in himself, then that magnet position is wrong. So you have to reverse the magnet wherever you have put. You must have put it on the meridian. You have to reverse the magnet. Third is, if whenever you put the magnet, sometimes these things happen that person feels immediately the pain vanishes. So that is the very good result, very good response to the magnet. So these three cases. And fourth is, if he is not there is no change in the any symptoms, then you have to use second hand. If you are putting it on the left hand, same meridian, you put it on the right hand. Then you will find the difference. Whatever patient will see the difference, you will see the difference in the patient's symptoms. Is it clear?
Okay. Yeah, very clear. Last one is very clear. And the second is gallbladder management. The patient is getting midnight 1 to 2 o'clock severe headache. The patient is getting left side, we say migraine, left side migraine, night 2 o'clock to 3 o'clock, 4 o'clock, like that. How will can I treat her in the daytime?
Can you please repeat the thing?
There is a patient, my sister, who is getting at night migraine left side.
Okay.
At 2 o'clock, 3 o'clock, it is a gallbladder management. But can I treat her during the daytime? She sleeps very well. By 2 o'clock, she gets up with a severe headache. After that, she is not able to sleep.
Okay.
So
so
can I
how
treat
long
the gallbladder meridian in the during daytime?
Okay. How long you are telling him to put the magnet?
I have not treated her because since she is complaining at night, daytime, I have not treated her. So can I treat her at daytime?
You suggested the magnet. Is she near you?
My sister is not here just now.
Okay.
Varsha ji, your speaker volume is too high. That's why that echo is coming, that sound is coming. Or you are having two systems on simultaneously.
Okay. Wait.
So you have to mute
Now
one
can
of
you
the
hear
systems.
me? Hello.
Yes, I can hear you. Yes, I can hear you.
Varsha ji, can you hear me?
Yes.
What I could understand from Anthony Amma Dhanrajas ji's question, that her sister is having this issue in the night time. Her question is, can she do the treatment? Can she do treatment in the daytime for a problem which is occurring in the night?
Yes, she can.
Yeah.
She should. She should.
Yeah, she can do the
Varsha,
treatment in the morning.
this
I mean,
answer
daytime.
because you have this problem. Yes, our all color treatments are done only during the daytime, and you should treat her during the daytime, even if she has pain in the night. And put your seeds slowly. What will happen? Your treatment effect will reduce the pain during the night time. And what you can do additionally, how many levels have you done here? Whoever has asked the question.
First two levels. First two
Just two
levels I
levels,
have.
so you know where meridians are, right? So you go
Yes.
to that time meridian. Where if she gets pain,
That is
say
gallbladder.
11 o'clock, you said first. So you go to GB meridian, find painful point on that meridian, and put seeds over there. Or if she has it later, then go to liver meridian during that meridian organ clock time.
Yes, madam. Yeah, now I understood. Thank you, madam. Thank you very much.
I have a question. Ma'am, when we put chakra magnet, you know, sometimes when we put bar magnet, people can make the feeling very clearly. But when we put chakra magnet, when I tried twice with some people who have like very space located, area located problems, I put chakra magnet, but they always say we cannot feel anything. Whether I do twice, whether I do set it, they don't feel anything.
Okay, what you can do is, don't worry. Yes. So, because you see, first of all, I want to explain that when we use chakra magnet, this chakra is round phenomena and bar magnet is stick. This bar magnet we are applying on meridians, and meridians are hetero, and the change you will see very quick. But chakra is round phenomena. This is homo world, and homo will not show quick change. But it doesn't mean that it is not working. Okay. Sometimes you have to, keep this magnet for 2 hours, or then after one day you ask, how are you feeling? And when you are doing treatment, whether you are doing 6 key treatment or level 2 treatment, in many times you will observe when you put magnets, it is not showing any symptoms. Yes, but then next day you ask other symptoms, how are you feeling? Are you fresh? How is your sleep? And if this person says, doctor, yes, yesterday I slept very well, and I was very hungry, I was feeling warm, I was feeling very energetic, this itself is a symbol that your treatment is working. Sometimes maybe you gave treatment for headache, but this headache is there or maybe little improved. Yes, but overall this person says that my energy level is very good, so it means your treatment has started working. Sometimes these kinds of symptoms also you have to focus, not just a patient says no knee pain not solved. Yes, because in chronic cases energies are, it is a process inside, there is a system working inside. It cannot happen, even miracles are happening with system. Okay, so you have to give time. Only thing is when aggravation is there, then you are changing the magnet. But you have to experiment this round chakra magnet. All these magnets are also giving very good results. But at the same time, if after doing all these researches and still if you feel that this is not showing any change, then it is very clear sign that to this patient you have to for this patient you have to choose meridian, because this person is responding well to meridian. So be very flexible, very flexible. Okay, he is responding to meridian, then do all treatment on meridians. Okay,
thank you.
Is it clear?
Yes, ma'am. Thank you very much.
Yes, madam. Thank you, madam. Very clear.
Oh, very clear. So now I want to show mini system. Please, who asked this mini system?
Ma'am, I'm Bindu. I asked this question, ma'am. Ma'am, actually, I want to that explain the situation where this point has come in my mind, because one of the patient, he's having wrist pain.
Wrist pain? You want wrist point on mini system?
Ma'am, on the left hand, on the left hand, on the left side, left hand, right hand, left side, right side, right hand, right side of the wrist.
No, you
on
just
the
tell
yang
me.
side.
Yes,
On
you
the
just
yang
tell me
side.
which finger you have, which finger is paining.
Ma'am, not the finger, that wrist, he's having pain on the wrist, right wrist.
Okay,
and
fine.
on the right side of the wrist, yang side,
Okay.
right side of the wrist.
Okay, so this, yes, this area.
Yeah, that on the right side. Yeah, right, down below the little finger.
Okay, this side. Okay, but in mini system, see, mini system will have just one small micro point for this wrist. This will cover left, right, all these areas. We need to reach that one point, and this will cover complete this area. We have to reach wrist, yang point. Okay.
Okay.
So everyone will pay attention. I'm showing this. This is very good question. And mini system, this is my favorite system in correspondence system. Just one needle, if you find the correct point, one seed on mini system is curing this wrist. So I'm sharing my screen. Let's see how my sharing screen is working, my camera. Please let me know. Can you see my screen?
Ma'am, we can see your screen, but it's dark.
It's blank.
Oh, it's blank. Just
yes, it's black.
It's black. So one moment. Share screen again. I'm trying to share screen. Just a moment. Okay. Screen sharing.
Yeah, for a moment we could see it. Now it's black again.
This is my desktop.
Yes, we can see this. We can see this.
But I want to show my camera, my hand.
It's black again.
Yes, just a moment. I will try again. I don't know actually. Okay. So, or maybe let me show if I can share some whiteboard is here. Let me check. Because I'm not used to this go to meeting screen share. Let me check. Otherwise, I will send picture in your group. So what do you see now here? I'm trying something, but
Black
It's
screen.
black color. Complete black, ma'am.
Okay. Okay, then I will leave this point and then I will share in my next meeting, or I will send picture in the group. Okay, because this I'm not trying.
Ma'am,
I'm
I can
trying
see.
to connecting.
Ma'am, because I asked this question because I applied seeds on the insect system, main system, on the toes and the hand also, but there is no relief. Even the yesterday I have done the spine meridian because that meridian is passing through the wrist, so I tried that also, sedation of
Ma'am, we
spine
can
meridian.
see your computer desktop.
I'm trying. I want to explain because this point will give great. Anyway, again, I will try. You can ask if you have any other question. You can ask, but I need time to.
Ma'am, so I just want to ask whether I have done the right thing
You
or
can give
any.
answer. I'm trying to put my camera, please.
Ma'am, if you forget to take the magnets out from the hand, suppose you have applied the magnet and after the whole night the magnet is left on the hand, is it harmful? Hello?
Keep
This
the
conference
the
will now
magnet
be
in the
recorded.
night, ma'am, after sunset, or we
Yeah,
should do
you
it.
can keep. No, you should be awake. You should not sleep. When you are
Okay.
sleeping, just remove the magnet and then sleep.
Okay, just for half an hour is enough, no,
Sometimes,
ma'am? The magnet.
It depends on the how chronic is the disease.
Okay. So what's
Okay.
the maximum time?
You put the magnet for 2 hours first initially, and if the relief is there, then increase the time by half an hour or 1 hour.
Okay.
Okay.
Okay, thank you, ma'am.
Is it clear to you now?
Yes, ma'am.
Okay.
So when you see mini system, I couldn't could not fix this problem, but yes, in next coming webinar, I will try this to attach my camera with my screen. So now for fingers, you see in mini system below the nail, I want to make it very clear that in mini system also we have skin level, and also we have this nail level. When you see the nail, see, I cannot show under my camera, but you will understand because you have knowledge of mini system. You will understand very quickly. You see this phalange here, this is blue line. See the tip, yes? So your mini system starts from here and it is finishing here. So this is called complete body, which includes the nail. Yes, this is one criteria. Second criteria is just skin level. So when you see the root, here skin is finishing, and then you have to remove this nail from your imagination, and in the skin area you have to see small hand, small body. Okay, small body, it means it is very see, if you cover this area with 6-7 seeds, you can cover all backside of mini system, but this is not correct idea to think like this, that you just cover all this back point with seeds and it will cover full body. Correct idea is that you should know your consciousness should penetrate, and in the small area you should able to reach the points of spine and kidney. So when you see, now first I will focus without nail. Okay, now see without nail, just this small area. And as I told you, how I explained you that to draw mini system, first you have to draw horizontal line. You have to exactly go half of this phalange, half of the phalange, and then all this finger area is one dot less than this square. You see your hand, when you measure your fingers and when you see this square part, you see the length of this finger and the length of this is generally same. Little one dot less, maybe one dot less. Finger is one dot less. Okay, same concept you have to follow on the yang system. You go to yang and then remove this nail from your consciousness, and then you divide this half, and towards the root of the nail, you will find tiny points of extremities, 2 legs, 2 arms. Okay, and here you have to stimulate. Same, you see, stimulate with this micro probe and try to check very precisely which is the painful point. Yes, and then on one point, after when you get very sharp painful point, stay there, massage that point, or you can do some moxa and then put just one fenugreek seed. This is one thing. And second thing is, when you see mini system along with the nail, then you're looking body, full body on this complete area. This is complete area. You will cover full body. It means your extremities will come on the nail and rest part will come on the skin. So nail will represent your extremities, but how we can put seed on the nail? We cannot put seed on the nail. Just massaging the root, just massaging the root will send energy to all these extremities. Yes, you have to imagine all those 4 limbs and thumb is down. In mini system, you see hand, thumb is finishing at the base of your finger, index finger, this last joint. Yes, same criteria. You will see that thumb is down and all this nail will represent 4 extremities. So when you massage the roots and check, and you have to check very gently because these points are very painful and very tender points. This is not just simple. You cannot give just deep pressure. With little gentle pressure, with micro probe, with patience, go step by step and check all these points. The moment you find the painful point, that is the point. That point will cure your finger if you have finger problem. This is how you have to work with this understanding mini system. Extremities part, knee or wrist, everything comes here. You see in this one line, in this root, your consciousness should see all these long fingers below the root. Okay. And when you come to wrist, yes, these are fingers. And when you come to wrist, then where is wrist point? This blue line, when you see this blue line, this is your wrist. This is your wrist, center point. So if you stimulate, now you can go to left, right also. You see your wrist point, and this is my thumb. You see, because mini system is baby of basic system. So if this is my left hand and this is my left arm and here is my left hand, so this blue line is your wrist. If you stimulate this area, this is towards the thumb, and if you stimulate this area, this is towards the little finger, wrist. So you can find painful point on the yang side like this, and precisely you can go towards the little finger as you say that your pain is here. Yes, this side. So you can accordingly go and you can find the painful points and do seed therapy. Yes, this is how I wanted to explain about finger, location of fingers, and also the wrist. I hope clear now. Is it
Yes, ma'am. Ma'am, actually what happened is that for the last 4 days, I am putting seeds on the corresponding area, but there is no relief. Then yesterday I studied the spine meridian because it's passing through the wrist.
Yes, see, you're talking about level 2. Yes, you're talking about level 2.
Yeah.
You have done level 2, yes. So you can just sedate spinal cord meridian, of course. And then if you're doing level 2, then please try to practice algorithm also, not just sedation. Sometimes one step is giving result, and then sometimes you have to practice algorithm. You know, all this left spinal cord meridian, you know, one is excessive and one is this deficient, and then you have to go to long view. Do you remember all this pattern? Algorithm?
Yes. Okay, ma'am.
Yeah.
Okay.
Please do algorithm.
Okay, ma'am. Thank you so much, ma'am.
So now we can wind up because now we have exceeded time. Commander Kapawar, we can have this discussion. We will continue.
Ma'am, I have a question, ma'am.
Mm-hmm.
Ma'am, my daughter has problem with her ankle. For last one, like when I treat her, whenever she sprains, there is a big swelling. I treat her with GB meridian and J on spinal cord. The swelling goes down, but the slight tender pain doesn't go. Every time she'll say that there is pain. Even I am doing correspondence also, ma'am.
Just a moment. Pain in the ankle.
Pain in the ankle, you know, ma'am, where your bone is there. I think they call it the fibula.
Which ankle?
So the not on the hand, on the leg, on the left leg, left side.
Left ankle.
Yes, ma'am. Left ankle on the right side where the big bone is.
See, then in your left hand.
Yes.
This joint is your left ankle.
Yes, ma'am.
Yes, you have to work here, and now you decide where is this pain. Towards the thumb side. See the direction.
Towards the little finger side.
Yes. Then you know this side is your big toe.
Yeah.
And here is big toe is you know, not facing the central line. So this is big toe, and here is your little toe. So when you go little toe, then you come down, and here nearby you search all those painful points.
Okay, ma'am. Okay.
Okay.
Okay, ma'am. Thank you, ma'am. Try. But the pain doesn't go.
Varsha,
I want to say something. See, ankle is the moving part, and come what may, we have to walk. So your daughter should avoid putting pressure on the ankle till the time the treatment is going on. That means that doesn't mean she should not walk, but yes, minimum possible walk she should do. Otherwise, she should give rest to the ankle.
But almost 1 month, ma'am, after 1 month, every time she will again sprain the ankle, saying that my leg twisted again.
But she got the relief after treatment.
Yes, she is getting the relief, ma'am.
Yes. So you have to strengthen the area, bone, muscle of that area. You have to strengthen that. Also, you can put green color on that joint.
Okay, ma'am. Okay, I'll try this. Yeah, thank you, ma'am.
Okay, Commander Pawar. Thank you so much, Varsha, Gitanjali, and all participants who have participated in asking questions and also giving answers. Thank you so much.
Thank you, ma'am. Thank you, Ms. Bhupinder.
Thank you, ma'am, for
Thank you,
participating. Thank you
Thank you
so
very
much,
thank you for
much.
everyone.
for taking
Thank you,
us
ma'am.
and giving us.
Thank you, ma'am.
Thank you, madam.
Thank you, ma'am.
Thank you,
Thank you,
Varsha.
ma'am.
Thank you, ma'am.
Ragini.
Thank you, ma'am.
Thank you. Good night.
Thank you so much, ma'am.
Thank you, ma'am.
Commander Pawar, you wanted to say something?
Yeah, I was just wanting to say it has been a wonderful session. Lots of enthusiastic. It's very heartening to see a lot of people have been trying, and then they are bringing the questions here. It has been a wonderful session, and I'm sure we will have many more in the going ahead in the future also. So, thanks again, Gitanjali ji, Nehal, who shared some wonderful success stories. I would encourage all ma'am's students, go ahead, try the treatments, and whatever results when you get, do share on the WhatsApp group also, whichever groups you are present in. And so thanks a lot. It is time to wind up. It's been a wonderful session. I think we have exceeded the we had planned to close by 6:30, but it is very nice. So I'm sure we'll have many more such sessions in future. So thank you, ma'am. Thank you, General Director. And thanks to all the participants for joining this. Thank you. I think ma'am can now close the.
Yes, thank you
Yeah.
so much. Thank you. See you. Bye bye.
Ma'am.
Bye, ma'am.